How do we treat the various forms of heart failure? Well, the first line of treatment is with medicines, and most of the people respond adequately to the medicines. And the medicines are like, we use certain drugs which can dilate the vessels so that the heart has to work against a reduced resistance, and whatever extra water that is accumulated in the blood, in the body, that is actually removed by diuretics through the urine. Now, there are certain devices which are also used to treat the heart failure. Now, as the heart enlarges, there are two very important things that happens. One, because of the lack of contractility, it fails to pump the blood adequately. At the same time, it can suddenly lead to a very high heart rate, which we call as ventricular tachycardia, which leads to death, immediate death. To prevent this, I will now show you the devices that is present today. Now, this is called the AICD, or Implantable Cardioverter Defibrillator. So whenever the heart starts beating very rapidly, this gives a shock to the heart and restores the rhythm of the heart. This is called the CRT. So when the heart has enlarged like this, it fails to contract synchronously. So the walls of the heart do not contract synchronously. So there is something called a cardiac resynchronization therapy, which is now a very important part in the treatment of heart failure, and that is done through this. So what we do is, actually we'll have a lead positioned here, one here, and of course one in the atrium, so that we are able to synchronize the contraction of the heart. And many a time what happens when the heart becomes dilated, like this wall, they're supposed to move like this, but if this moves like this and this moves the other way, and by the time this returns, this moves the other way, this is what we call as desynchronization, and this can be resynchronized, or the whole function can be restored by this device, and this is called the cardiac resynchronization therapy, and or the CRT. And this large device and the small device, in terms of pacing, they do the same, but this has an additional quality that it has also got the qualities of this. So whenever there is abnormality in the rhythm of the heart, this will give a shock and restore the rhythm. When these have failed, that means there is hardly any muscle mass left in the heart, then we are left with only two options. One option is a left ventricular assist device, which is the artificial heart, and it's a device which is actually the heart is operated and the device is attached here, and there are tubes coming out of it, and it circulates the blood, it pumps the blood into the whole circulation, and there is a battery which runs this 24 hours. They are charged and they are replaced, and the whole thing is called the left ventricular assist device. When this also fails, ultimately the final answer is a heart transplant. And in our center we are doing heart transplants, and only problem is to find a donor. So anybody who dies and who has a normal heart and dies of some other cause, maybe an accident or maybe a stroke, or there are various other causes of death not related to the heart, then this heart can be taken from a donor and attached to a person who has heart failure. So normally what is done, that this part of the entire heart is removed, only this part is left behind, and this is also left behind. So the other person's heart comes in and they are attached, and that heart starts pumping. That is what we call as cardiac transplant. Thank you very much.